Good morning. Happy Monday, December 25th. So what's going on? Well, let's see here. Only 20 days till Christmas, and you can see I've got my Santa Claus tie on. IRS has announced that they're going to raise their interest rates from 6% to 7%. Oh no, what do? Pay your taxes on time. That's what you do, so you don't have to pay any interest rate. The other thing that is, student loans are dead. That's gone. Goodbye. We could have seen that one coming, right? Free money? Nothing in life is for free. Anyway, what else is happening here? Tylenol and ibuprofen for children. That's in short supply. So if you see it on the shelves and you've got kids, maybe you want to grab a bottle or two. But let's not hoard, because somebody else is going to need it too. Anyway, let's get to today's topic. Hey, so today's topic is HMOs versus PPOs. We're now going to focus a little bit more on the under 65 individual health insurance marketplace. An HMO stands for Health Maintenance Organization. The product is originally designed to keep you healthy. PPO stands for Preferred Provider Organization. That product was more for the more discriminating people in terms of wanting to have their own doctors, freedom to go to specialists and things of that nature. And it favors more people who are sick, who need to have health care done on a more of an ongoing basis. So we all know traditionally with an HMO, you go out of network, no coverage, SOL. Well, on a lot of the plans today, even the ones that are PPOs, if you go out of network, still no coverage. So they're really are blending together more HMOs and PPOs. So pay attention to that. No matter what, you don't want to be out of network, period. With a PPO, if you're out of network, you're subject to whatever the provider wants to charge. In network, the provider can only charge you the negotiated rate. So you want to stay in network, whether it's an HMO or a PPO. And remember, a lot of PPOs today are saying you're out of network, not like in the past, there is no coverage. Now, here's another thing that whether you're in a PPO or an HMO, you have to make sure, as I say, you stay in network. With HMOs, and I'm pointing the finger at Northwestern Medicine, you can have an HMO, you can go to your HMO doctor who tells you you need to have a procedure done, you go to that doctor makes all the arrangements, and then months later you get a bill saying you're out of network. This is a common problem with Northwestern. They've been spanked in the past by some insurance companies by removing them, we all know, from the individual health insurance policies. But for you and I, the patient, we need to make sure, do not trust Northwestern Medicine, period. Do not trust them. Northwestern, if you're listening to this and you want to discuss it face to face, give me a call. My number's at the bottom of the screen. I'll show you how you're hurting your patients. I'm ranting, I know, but you know what? When I sell something, I expect the insurance companies to pay. They're black and white. They will pay exactly as they're supposed to. But when HMOs like Northwestern are referring you out of network, Northwestern, pay the bill. You're the one who made the mistake. And to you and I who are buying our insurance, we need to make sure that our providers are in network. So as we're really into the end of this open enrollment season, ask me. My numbers here are at the bottom of the screen. I'm happy to look up your providers to make sure your providers, so there's no surprise to you when you have procedures done and you get these claims. And that's also important for people who've purchased these Medicare Advantage plans. Joe always says, one, just say no to Joe. Guy sells nylons, come on. Make sure your providers are in network if you have a Medicare Advantage plans, especially if you've called that 800 number. We, the agents, make sure your providers are in network. When you call that 800 number, I've had people walk into my offices time and time again with claims and saying it's not covered. Gee, you went to Dr. Smith. Who's Dr. Smith? My doctor's Dr. Jones. There you go. The 800 numbers just enroll you. They don't educate you. They don't make sure your providers are in network. Maybe not always, but often enough. Remember the old adage, buyer beware? Buyer beware. Hey, Mark. So I guess just enough ranting, right? I'm sorry about that. What's going on at the MLD agency? Well, we've been working very hard, paid the price for having Thanksgiving weekend off. A lot of people procrastinated. So we've been very, very busy this week enrolling in dental plans, Medicare Advantage plans, drug plans, supplement plans. Been very, very busy with that. Picked up a couple of new clients with the with policies this week. In fact, I'll show you their picture here. There you go. So life is good here at the MLD agency. We hope you're getting ready for Christmas because, like I said, it's just 20 days away. Is your Christmas shopping done? Until next week.